How are you?
Nice
Doing
seeing folks
well.
that I know and nice seeing folks that I hope to get to know. My name is Chioma Inaji. I am a program director at the Multicultural AIDS Coalition, which is located in Boston, Massachusetts. We are a grassroots HIV serving organization. And we are honored to be a convener and founder of one of the founders of United We Rise. And United We Rise is the one convening this session with you all today. And the title of this session is Navigating and Resisting the Dilemma of Black Erasure. It's part of our Couch Conversation with Every Black Body series that is led by our subcommittee, Change the Narrative. And this is actually co-led by our subcommittee, Change the Narrative and HIV Policy. So this is going to be an amazing conversation. Just to give you all, if you don't know, a little bit about United We Rise. United We Rise started about 4 or 5 years ago when three organizations came together, knowing that something needed to be done and something needed to be done different for Black folks. And so we brought together a group of about 30 Black researchers, Black people living with HIV, providers, activists, folks across HIV, harm reduction, all the ways in which HIV intersects with all other inequities. We brought folks in the room to say, like, what do we need to do? And initially it was like, okay, we'll bring together folks and do some type of conference. But then folks were like, no, we need a whole thing, right? And so folks decided that it was going to be a collaborative, intersectional Black collaborative, led by Black peoples for Black folks, and that the main question that we're going to be not only asking but also answering is what would it look like if Black people led the end of the epidemic, not only for Black folks, but for all folks. Because we know if we tackle what needs to be done for Black folks, then everybody else is going to be all right. And so United We Rise is a group of about 20 individuals who sit on the planning committee and do work across HIV policy, do work around change the narrative, also do work around education and awareness around sexual health, and also do work around HIV funding. And so it's a very broad a group of folks who are trying to tackle HIV for Black folks across various sectors. And so some of the folks you will meet today have been connected to United We Rise. There are other folks here on the call, on our couch conversation, who have been part of United We Rise. And so thank you all for continuing to connect and be part of the movement. So now what I'm going to do is I'm going to hand it over to Carl Bologna, who is at AIDS United. Am I saying now that you're the executive director?
I am CEO-elect. On
CEO.
July 2nd, the title will change to President and CEO at AIDS United.
Excellent. Thank you, Carl, for joining us. So as part of y'all give it out, give a hand a shout out for Carl. We always want to support and
Yes,
celebrate
Black
folks as we
leadership.
get in leadership positions, leadership of change, and you deserve this position, Carl. And so we are excited that Ace United is partnering with United We Rise on these couch conversations with every Black body and providing a short sort of opening around what is going on now. What do we need to be thinking about? And just giving us a 5 minute sort of update. So, Carl, I'm going to hand it over to you.
Can I share my screen? Let's see. I'm sorry, bear with me. Can y'all see that all right?
Yep.
Yep.
Okay, great. I just wanted to, well, one, thank you for the opportunity to present to you all. I know we're in really sobering times with, all of the gains in prevention care and equity at risk of being rolled back by this administration. So I was going to kind of ground us in, uh, a bit of a sobering federal update. I didn't know who would be on this call, so I know folks here, many of whom are very much in the know. But I think it's just important grounding for what's happening at the federal level and how it's impacting communities. Um, so, we're in Trump 2.0, and the administration continues to take radical re-engineering of the federal government that really, frankly, dismantles the legacy of the New Deal and the civil rights era. As you all know, entire agencies are being gutted or eliminated with a concerted effort to weaken the civil service through firings, executive orders, and regulatory backdoor changes. And these moves are not just about efficiency, as they would have you believe. They're about eroding the federal government's ability to ensure health, equity, and justice. And it's our job to fight back against all of that. Um, at the Department of Health and Human Services, there's complete turmoil, frankly. It's not any more clear anywhere as it is at HHS, with the elimination of over half of the branches in CDC's Division of HIV Prevention, gone to our branches in STD, hepatitis, TB prevention, and the Office of Minority Health at HHS and CMS. Of course, USAID, a vital global health arm, for equity and global health, has been stripped down across the board. There's been about 25% workforce reduction at HHS, with infectious disease prevention taking one of the biggest hits. They are framing it as giving control back to the states. The administration framed these moves as restoring state control. In reality, it's about consolidating power in the executive branch and stripping Congress and the courts of checks and balances. You may have seen in the leaked FY26 budget document showing the administration's planning to cut 33% to HHS, eliminating the CDC's Division of HIV Prevention, and removing other key programs like EHE, and again, the Minority AIDS Initiative. The proposed skinny budget, as it's called, includes a 44% cut to CDC funding overall, which is frankly an existential threat to our field. Of course, on top of the executive actions, Congress is advancing legislative changes that would devastate the Medicaid program. New work reporting requirements could cause between 8 and 15 million folks to lose coverage by 2034, many estimates conclude. And moreover, the implementation of work requirements, and I should call it work reporting requirements, could have broader economic consequences. The Commonwealth Fund analysis estimates the nationwide implementation could result in up to 449,000 jobs lost in 2026 alone, particularly in the healthcare sector. So these are going to threaten real services and real people. It's not a theoretical impact. As you all know, Medicaid is essential to our domestic HIV response. It's the backbone of the HIV response, frankly. It supports community-based organizations, public health departments, and the very structures we rely on to deliver prevention care and treatment. Cuts to Medicaid don't just impact insurance, they create a ripple effect that would destabilize everything from Ryan White funding to PrEP access as well. Here, this slide, it illustrates how deeply interconnected our HIV response is with federal funding streams. You see the Medicaid, Ryan White, public health dollars, even coverage from private insurers post-Braidwood are all affected. If we cut one leg of the stool, the rest, will wobble and collapse. And CBOs will be the first to feel the squeeze, but it's not going to just stop there. It'll have deeper impacts in communities. And I think finally, when states are forced to reduce Medicaid eligibility and benefits, especially for immigrant populations, we see cascading impacts. We see more uninsured people in need of care, local governments forced to decide between excluding immigrants or covering care without federal reimbursement, uncompensated care rises leading to service cuts, people delay or avoid care, and HIV incidences, of course, directly will rise, resulting in more illness, more inequity, and more deaths as a result of federal actions. It's a dire situation, and I'm sorry to always be the the encapsulating of bad news, but it's a lot to digest. The pace and the scale of these changes are unprecedented. I'm glad to stay on and be a part of this group and this community, because we're not powerless. When we are vocal, we have had success in getting members of Congress to push back on these proposals, to push back on these cuts. And so I think we have to kind of together stay informed and organized and really unapologetic in our advocacy as we fight back. That's my update.
Thank you very much, Carl, for that update. Yeah, it's hard times, right? Like, period. It's hard times. And so hard times is going to require us to have sort of hard conversations, not only with other folks, but hard conversations with each other and with ourselves. And so I'm going to ask Daniel Downer if you come to the front stage of Zoom and support us and just grounding us. We heard all this information that Carl shared with us. We know the reality. And we're about to get into a deep conversation with some of our top leaders and CEO, Black CEOs of organizations. And they're going to share some stuff with us we may want to hear, we may not want to hear. And so I ask that you join us and just taking a moment to ground us as we prepare for this couch conversation.
Absolutely. Thank you so much and welcome everyone. Before we begin, I just want to invite us to take a moment to ground ourselves in not only our bodies, but also in our purpose and in each other. And today I want to offer this moment as an act of care. You know, in the work that we do, especially in community, in HIV work, in resistance against systems of harm, it's so easy to be pulled into urgency. I think that's something we all can resonate with. But our liberation is rooted in love. It is rooted in our breaths. It is rooted in remembering that we do not walk alone. And especially in times like this, I lean so heavily into my faith as a Muslim. And so I'll be sharing a simple prayer, what we call a dua, as part of this grounding for us today. And you're invited to receive this in whatever way feels meaningful to you. You can receive it as a prayer, you can receive it as a reflection or a shared intention. So I want us to begin by noticing where our bodies are in this moment. So if you feel comfortable, just allowing your feet to rest on the ground or simply feel the earth beneath you wherever you are. And if you want to, you can close your eyes or soften your gaze. And let's all collectively take a deep breath in. And I want us to slowly breathe out and notice your shoulders. Let them soften. Notice your jaw. Unclench it. Notice your breath. Just let it flow naturally. Even here, even now, we're all being held. O Allah, ground us in your purpose and anchor us in our love for one another. Bless us. Bless this community, those who serve, those who fight, those who heal, and those who live with courage every single day. Protect us from despair. Sustain us with hope. Strengthen our hands when we are weary. Let our resistance be rooted in mercy. Let our organizing be guided by justice. Let our care for one another be boundless. We ask for liberation, not just for ourselves, but for all who are forgotten, all who are burdened, all who are brave, even in the most quiet of ways. Let us be vessels of light in heavy places, and let our community be a source of healing, a source of belonging, and a source of dignity. Amen.
Mhm.
Let's take one final breath, a deep breath together. Inhale, and then exhale. And as we return back to this space, may we carry the stillness of the moment with us. May we remember that we are not alone, that we are rooted in care and resistance and community. And I want to thank each and every one of you for being here with us today.
Thank you, Daniel. Now I'll hand it over to Gary Daffin, who's the Executive Director of the Multicultural AIDS Coalition, to welcome our discussants and to get our couch conversation started.
Thank you, Choma. Thank you, Daniel, for a much needed grounding. I think a lot of us, after hearing what Carl has said or hearing it every day, live in a little bit of a world of anxiety. And so part of why we're here is to sort of have a conversation so we can hear what we're all thinking, how we're feeling, and how we're responding, and help each other to, be able to ground ourselves and remember our history and how resilient we are, how we persevered over time, and talk a little bit about what it's like to be in this moment. So thank you everybody again for joining us. I want to introduce our panelists, conversants, discussants, who are going to really have a conversation between themselves. I'm going to interject with questions, but people will freely just discuss these issues amongst themselves. First, we have Ernest Hopkins from the San Francisco AIDS Foundation. Ernest was also one of the founding members of United We Rise, and of course is well known by all of us. Daphne Ward, who's the executive director of the Southern AIDS Coalition, and has been in the work for quite a while. Mandisa Moore O'Neill from the Center for HIV Law and Policy, and Deva Sean Gilmore from Blackout, a direct service organization and advocacy organization. So we know what is happening in terms of the chaos of the government, and I think we tend to be clearly focused on what's happening within the HIV world. I think part of what we want to bring to the conversation is how some of the other some of what's happening at a slightly higher level, and how that is contributing to erasure of Black people and immigrants, and LGBTQ folks, particularly trans people. And we want to, if we all see every day that this government is removing acknowledgments of our accomplishments as Black people from public records and from landmarks, literally taking our names off of things, banning books about and by for Black people, dismantling civil rights protections, eliminating checks on political corruption, which is at levels we couldn't even imagine, and blackmailing businesses and educational institutions and other folks to play along with them and to participate in this attempt to really bring us back to a pre-1954 America. And I think that's all background to what we are facing and looking at in the HIV world, and how things might need to change. But really, how are we existing both as leaders and also as frontline folks? So this conversation is more with people who are in leadership positions, and the second part next month will be with people who are more on the front line. So I want to start, just have everyone kind of give us set the stage of sort of where you are in this moment. Have you and your organization been affected by these recent federal policy changes? And these, the attacks on DEI and immigrants and this so-called gender ideology, which doesn't really make any sense. Just want to get a sense of how that has impacted your programs, your staff, your funding, and what that is meaning for the communities that you serve. Want to start with Ernest? You want to start a little bit?
Yeah, I can start. I would say that California is in a precarious position for a variety of reasons. We're a border state with Mexico. Our governor is very political and is rumored to be a potential presidential candidate. Uh, and he is searching for a winning strategy to appeal to the largest segment of voters. And so for him, that has meant starting a podcast and inviting lots of radical right-wing people on and agreeing with them on things like transgender sports representation and the ways in which the Democratic Party has been scolding white men and alienating them from the party. All that to say that when the president said that we needed to stop supporting the undocumented individuals in the state with our own state dollars, providing a supplement to Medi-Cal, which is the name we call our Medicaid program. He immediately sent a notice saying, "Oops, stopping that program. We're not going to do that anymore." Uh, Recently, just over the weekend, the president said that if we continue to allow transgender individuals to participate in sports, and he it kind of always focuses on transgender women. It doesn't say a lot about transgender men, but we allow them to continue to focus on to participate in sports, that he is threatening to cut our federal resources, access to federal resources. And so the governor finds himself in a very precarious situation. N- That in combination with the fact that our senator, our newly elected senator, Senator Schiff, was one of the impeachment managers for the president. Combine that with the fact that our representative in San Francisco, Nancy Pelosi, was the Speaker of the House when he was impeached, and led those charges to investigate and excoriate his bad behavior. We have um, we have a lot of targets on our back, and so the wave of activity from the federal government and the specificity of it around gender affirming care and around the undocumented and all of the ICE activity has created an environment of fear, has created an environment of uncertainty with regard to providers, and I think rightfully so, has left our our community of clients fearful and completely uncertain about how they're going to access their care, whether they will be able to continue to receive what they do. And our providers also in the same boat, not clear about whether they will be able to continue to serve the constituents that they have been serving heretofore. So that is a recipe for people staying away from care, infrastructures that have been built over time being destroyed, uh, the general public health of the population being undermined because people aren't going to risk going into medical centers to get things seen after if they are fearful that they're going to be swept up by ICE. Um, all of this is intentional. All of this is exactly what it was designed. It's doing exactly what it was designed to do. Um, there's no confusion about any of this. And I just think take those examples and multiply them by many multiples, and you have a snapshot of what's happening across the country, depending on the leadership of the state and depending on whether it's a border state or whether it's red or blue or purple. Some form of that is what's going on. Um, and makes all of our jobs even more challenging. And once again, the people who are actually receiving services that are funded by federal resources, it really creates a really precarious environment for their health. I think maybe you're muted, Gary.
Sorry. Daphne, I was just asking, how are you experiencing this moment, particularly being in the South?
I mean, I could say ditto to so much of what Ernest just shared, and you would think that the forecast coming out of California would be much warmer and sunnier than what you just shared, Ernest. And sadly, it's not. Our work at Southern AIDS Coalition is very intentionally focused on the Southern United States, and we're primarily red states. So a lot of what we're seeing is not new in the context of kind of socially, culturally, what we've been battling um, with our local and state lawmakers. And what we have relied upon for so long in the South is some accountability at the federal level. Southern states didn't transform their laws and increase access because they wanted to. And so now what we're dealing with is not just the long held oppressive issues and systemic injustices and all that we've been dealing with in the South when it comes to Black folks, brown folks, folks of all experiences who've been marginalized, but now we know they are feeling very much affirmed and emboldened by the fact that there's no accountability for those behaviors. You know, most Southern states have not expanded Medicaid. So there is true fear around what is going to happen with the little bit of healthcare access we have in our states. You know, as far as what we have seen in our partners on the front lines, I've gotten a number of calls from folks who are scared they're never going to get reimbursed by their states for services performed already. Many of the organizations doing the heaviest lifting have the least resources. And so the fact that they are having to chase down reimbursement to keep their doors open is a huge threat to access to healthcare in a lot of our communities that have the least amount of resources. And so that's a very real issue that we're seeing. Our organization is not directly federally funded, but a subcontractor on a number of programs, including research. So there is a lot of concern as we're talking about the dismantling that Carl described so well. Research is a huge part of that, and particularly community-based participatory research involving folks that look like us to ensure that we're a part of what's happening in the breakthroughs and all the things that need to happen to improve public health. We're just really uncertain in this moment what's going to happen with the number of those. Not to mention a number of organizations that are funded around EHE includes orgs that are doing really important advocacy work in addition to direct service work, community mobilization work. So many pieces of the puzzle for ending the epidemic are wrapped up in organizations that are now feeling very uncertain in this moment. And so I think that's the reality of where we're sitting right now. And I'm sure all of my colleagues have their own issues on their desk with what's happening in this moment, but it is truly a moment that is affecting everyone. I mean, and I think that we can talk about the long history of discrimination and oppression in this country, and we can also say in the same breath that this is different, and that we have to be prepared to fight differently in this moment.
And Rashawn, you're on the front lines. What's happening in the middle of the country?
For starters, a little late breaking news in case you all didn't know, but Blackout's located here in Kansas City, Missouri, and Kansas City, Missouri is the Kansas City people most often are thinking of when they say Kansas City. So I was not indifferent, but not as concerned when I got the news over the weekend that the wannabe white supremacist cosplayers from Patriot Front were marching through the streets of downtown Kansas City, Missouri, and they marched from the World War I monuments, the only one in the country, and it's a big, beautiful museum and all this from there down through some of the arts districts and that sort of thing. Now, luckily for them, they chose the right side of town. Because we know of some other examples where they've shown up in the wrong side of town and got the kind of greeting that they deserved and were run out of town, both in Atlanta and then I believe it was just outside of Cleveland, Ohio. So in deep red Missouri, we are confronted with a legislature that is adamant about, not only introducing, but forcing through some of the most arcane and harmful legislation that will certainly impact Black and brown communities, but most especially queer and trans folk. And that is the aim. And for a very long time, I thought of Missouri as sort of ground zero, even in the space of HIV criminality because of the Michael Johnson case. So that backdrop exists, right? And we're seeing the impact. I mean, we have so many of our partners, collaborators, friends whose budgets have been slashed and they've had to do layoffs. And I am quick to remind my team of the cost of doing business to make sure that they each have their jobs, because I'm determined to make sure that we're okay. But that determination for us started back at our founding in 2017 and 2018. And we made one critical decision at the outset about how we would be funded that is providing us at least some insulation from the decision making that is happening from this regime, because it's not an administration, but from this regime in DC. And that decision was that if we were going to invest our time and our resources and energy and our talent into building something, one, it had to be a vision big enough to merit bringing our full selves to it. Number two, it had to be something that was not going to be dependent on the big three funding wise, and I'll enumerate that in a minute. And then thirdly, that community had to be in the driver's seat of everything that we're doing. And so Dafina mentioned community-based participatory research. That is where our origins are. We didn't want anybody else telling us what we had to do, needed to do, or being a part of some larger study that would require us to, sort of be diluted out. And I mentioned that because of this piece, the funding with the big three. We decided that if we were going to create a model that could really be sustainable, it should be able to be sustainable at the start, at least, without the support of CDC, HRSA, or Gilead. And I'm not saying there's anything wrong with any of them. And if they want to write checks to us today, by all means, I'll drop the address in the chat. But the point was, we did not want, and we could foresee a situation such as this. And that's not to say anybody is wrong for how they have structured their organizations and how their funding is structured. It's just to say that this is more than a wake-up call for all of us about how we fund our organizations and the work that we do. Because for most of us in the communities that we're in, if we don't do the work, it's not being done. And we cannot rely on groups who show up as allies, in May of 2020, but by May of 2025, they backing off and can't figure out why we don't want to come shop at their store anymore. So I think that there's some really uncomfortable conversations that we are going to have among ourselves. And I want to throw a few of those out, a few thoughts out anyway. One, this is psychological warfare. This is psychological warfare. It's not just about funding and policy. It is strategically and very, very, very diabolically designed to keep us guessing, to keep us fearing, to keep us moving from here to there. And we just have to see that for what it is. And when I say psychological warfare, I just mean that the notion that because you take some pictures down at the Blacksonian, that somehow we don't exist, or somebody can't say gay or queer or black or whatever, and that somehow we don't exist. I just want to make sure that we are constituting for ourselves what it means to be present in community. And part of that showing up means that our communities are looking for us to lead for and with them. And so I'm kind of dividing my friends up now into two categories. It's not black or white. It's not even red or blue. It's really, are you Harvard or are you Columbia? That's my conversation for funders. That's my conversation for would-be partners, is are you Columbia or are you Harvard? Can we count on you as things continue to deepen and likely worsen? If we cannot, then we're not aligned and we're not going to be in partnership. I know it's nonprofit malpractice. I'm going to say it anyway. That kind of money, I turn it aside. No, we don't want it. And I know some folk don't like it, the arrogance. Don't you pro-black queers need some? We probably do, but not yours. Not with the strings that come attached to it. So here's what I want to say. We need to be surging resources to the parts of our community that are even worse off than some of the rest of us are, because there are even levels of privilege within our organizations and communities and our resources. Carl talked about this being an unprecedented time, and I agree. But unprecedented times call for unprecedented approaches, unprecedented strategies, innovative solutions. It's not a time for us to retrench. It is a time for us to really step up. And part of that means we may be needing to look at and have some conversations, y'all, about consolidation of organizations in order to be able to leverage resources and to make sure that we can survive long enough to get through this. And it's not just about the next year or two to the midterms. It's not even about the next 4 years, because whatever's left after even today, we still have a long way to come back from. So I just think that's a part of it too. Gary, are you about to start play me off? I can be quiet. Without a
I
script,
was about
normally
to.
I keep going. I'll stop talking.
We're actually gonna get to some of
Going.
those things later.
Thanks.
Mandisa, you're back. So what are you seeing? The organizations you work with, your organization, other organizations that you work with?
Well, I work with all the organizations here. So first, I want to say I'm Mandisa, and I do apologize for my internet issues. I'm on my phone, so if I drop off, just give me a couple of seconds, and I'll be able to unmute, and come on audio pretty quickly. But I don't like to go last with the room full of sharp people. So here we are. The first thing that I will say is um, we have to be very, very clear of the political moment that we're in. And we have to be able to name that we are on a very quick march. We are currently in an authoritarian regime, and we're very quickly, very fast on a march to fascism. And the reason why I say that is not to grow fear or not to grow anxiety, about our conditions, but I come from a school of thought that honestly and clearly naming something is a necessary step in resisting that thing. And as long as we're in a place of not using those words, or saying, oh, well, like we have to get America back to where it was, or this is not the country I know, or these other ways of like not talking about a history of white supremacist terrorism of not only Black people, but of those in closest proximity to Black people, we are always going to be in this state. And so that's why I name it as what it is. And I also think that they actually aren't trying to bring back 1954. I think it's actually about trying to bring it back to antebellum era, namely undo the 13th, 14th, and 15th Amendment, namely the 14th. I think everyone should be terrified at what they are attempting to do as we speak around undermining birthright citizenship. I know I'm a lawyer. I know there are people on this call who are lawyers, but I know that there are people who are not lawyers who know the importance of the 14th Amendment to almost every fundamental right that we've been able to fight for in the 20th and 21st century. So while immigrants currently are the target, that should be enough to have all of us up in arms. Like, let's be clear. And if it's not, check your shit. Because part of how we got here is people who we know and love said it was okay that trans people don't have rights. It was okay that Black folks don't have rights. It's okay that immigrants don't have rights, but I should have them. Because we still believe that this concept of respectability gets us safe. And as people in the HIV world, I think it should be abundantly clear no amount of of dissing sex workers, of dissing people who use drugs, of moralizing HIV has gotten us closer to a collective liberation. So I think we, perhaps more than others, know that framework is not getting us free. But for folks, outside of the HIV world, again, honesty as a necessary part of resistance needs to be able to name part of how we get here. Is this idea that, oh, well, I'm okay with these people not having rights, but how dare you use the same framework that I was okay using over here? Now it's being used on me. And the 14th Amendment is so key to that. And it's not a surprise that when it was first, passed, it was to ensure that formerly enslaved people had full citizenship that had been stripped for us. So again, when we talk about anti-Blackness as the core of this all, literally that's what we're referencing. An amendment that was for Black folks having the full citizenship that has been denied, that has been used and interpreted in ways that I 1,000% agree it should have been, is being used to undermine so much. That should have all of us terrified. Again, not to end at terror, but to understand what's truly at stake and to wake it up and continue in our resistance. I also think that it's very telling in this moment when folks make a lot of references to what happened in Nazi Germany. And again, this this regime really thrives on ahistorical people, right? Because if you read even one book about the Nazis, you know that all of their ideas came from the US. Nothing that they did was not inspired by the atrocities that Black folks were experiencing for decades. So we don't need to actually cross the Atlantic to talk about the horrors. We actually need to look right here at what they saw us doing, and we're like, oh, we could do this over there. In fact, y'all come show us how to do it. And so I think that that's really important in the moment that we're um, in terms of what are the strategies. So we are mostly a group of attorneys who work, at the intersections of the criminal, legal, and public health systems. So this may be an odd question for us to ask, but I think it's a important question for attorneys and everyone else to be asking. What happens? How do we show up for our people as all that we have known of the rule of law is consistently being undermined? Now, I want to be clear. I'm not saying that the injunction should stop. I think it's important as a strategy to continue to file, and make the cases that all of this that is happening is unjust, it's unconstitutional, namely because it's not following any kind of due process. And I think we also have to be prepared for what has already happened. Court orders have almost consistently said these things are wrong, and they have continued to happen. Whether or not we want to say it out loud, we are in a moment where they are ignoring court decisions. How do our people get their medications? I always say this, but in 2020, folks acted like they didn't understand what defund the police meant, which was willful and performative, because we knew you understood it, because everything is being defunded now except law enforcement. So you clearly understood what it means for government resources to be defunded, because literally every institution but one has been defunded. So the question I have, for those who do work, if it's around the criminalization of HIV, the criminalization of sex work, of people of trans experience, what does it mean that we now have a larger group of people with even less resources, while there literally was an executive order about 2, 3 weeks, 4 weeks ago, saying more tools need to be in the hands of local law enforcement? Right. That blueprint for increased criminalization is very much there, and the resources to fund our criminalization is very much there. So how are we including strategies for safety and security? I'm not thinking just bail funds, yes, bail funds, representation, resources for folks, support on the inside, but how are we including analysis of criminalization as an integral part of ongoing authoritarianism and fascism? Right now, in Louisiana, which again, and Dafina says this all the time, and we should listen to her more, of course, obviously. But as goes the South, as goes the nation. I'm from Louisiana. Mike Johnson wrecking havoc every day. Cassidy, a supposed doctor who has played an integral role in empowering and emboldening RFK Jr. Clay Higgins also in like all of these currently like the top person at ICE was the former head of wildlife and fisheries in Louisiana. It's wild that somebody whose job it was to regulate animals is now in charge of ICE. Now we see why they're going into hospitals and schools attacking people who just gave birth, because the person you have training you used to raid animals and and all of that. So all of that to say, our opposition is very well organized and is actually being very clear on how they see us. And if we continue to appeal, like try like our strategies of we're human too, we're more like you than they are. I think we have to contend if that I mean, one could question if it was a viable strategy 10 years ago, but I think we definitely have to question if it's a viable strategy now. So all of that to say, my organization, the Center for HIV Law and Policy, I think are most known for our work at the state level, working with state coalitions to reform and repeal their HIV, STI criminal statutes. But a lot of that work happens because of our relationships and partnerships that we have at the federal level. So while CHLP, has not received federal funding, and so in that way hasn't had any risks, many of our partners, the people who we work with, both at the federal level, at the state level, do. And so it's been a major shift in terms of who we've been able to work with. And also, many of our partners in state and local on the ground are worried. It's intentional. I don't want to say it's impossible, but it's harder to engage in advocacy if I'm unclear like about my housing situation, right? Or if I'm unclear about what's going to happen as far as medication for the next 6 months. So I also think of, as was said, like it's a tool of if people are trying to get like their basic needs met, it's harder to organize, it's harder to resist. So how do we also think about people's direct service needs as a part of like what it means to do advocacy work? So I'll stop there, but we can talk more.
Great, great. Thanks. I think you did a very good job of explaining what we mean by erasure. And I guess we're going to talk a little bit more about potential visions of the future and looking at what we need to maybe change completely or fight to sustain. But I want to ask the question in terms of being in the position of leadership. And I think we all agree, everyone has said is how we all have been feeling and what we're all experiencing. But I guess the question is that a lot of people have is being in a position of leadership, potentially organizations that are funded by the government or subcontracted to the government or funded by corporations who may or may not be pulling back. In your role, what are the tensions that have arisen, or that you see in other organizations as well? What are the tensions between, standing by your values, but also trying to sustain the work that you're doing, sustain the funding that you have, but not capitulating to what is being asked of organizations. And I think that's one of the dilemmas that we wanted to ask people about. And I think it's easy to say that, well, this is these are our values and this is what we believe in. But like when it comes to you actually have funding or a contract and you've got to make decisions about what they're asking you to do, how are you thinking about that? How are your organizations managing that? And have you made those decisions? Anyone want to jump in there?
I'll start us off and say I think the decisions are ongoing. And I think that is what's part of the challenge. It's not like there's an end in sight to the harm that's being done. And so as we're talking about dealing with this regime, and I really appreciate the way Mandisa laid out Erasure And this whole idea of like alignment with our values as organizations that are centering the needs of folks living with the most impacted by HIV means that we're holding also the well-being of the folks who work for us um, in highest regard. And so I think there's the complexity of the realities when we're talking about our values, when we're talking about MIPA, and we're talking about the centering of lived experience. You don't want to do harm, and so there's that's the very real reality Rashawn talked about, the layoffs and the rifts and like the reality of what we're seeing happen to our workforce of community folks who many of them carrying many of the heaviest loads are themselves living with HIV and navigating these realities of housing, stability, and so many other things. And then how do we as organizations charged with mission to move us towards ending the epidemic and centering community? How do we do that um, with integrity in moments like this? I'm naming that as attention, because I think that is a true one. Many of us are carrying safety, the safety of the folks who work for us as they're going into spaces doing the work, or the very feeling of safety or unsafety they're holding on the day to day because of how they might identify or who they are in the context of this landscape we're living in, giving folks room to feel that, to navigate that, and also supporting them while also having these requirements around being able to do a job on day to day. That's a tension of leadership too. So I'm naming those because I think those are they're very real and they're hard. And I think the last one that I'll name is the transparency piece, because I think we all as leaders believe in transparency, and like we're not going to pretend that this isn't happening, right? Like it's not like the world is affected by our organization is we're a-okay. That doesn't serve anyone. But when you're talking about transparency, you also have to be very intentional and clear, and also recognize as leaders that there are decisions you have to hold that are hard and challenging, and they may not always be understood. And so there's just a number of tensions I think we have to hold in this work. And it's also why it's so important to have a circle of trusted leadership around you and folks you can turn to and count on to hold your confidence, to tell you when your slip is showing, and to also support you when you're making those really hard decisions.
I appreciate so much what Daphne said, because you just laid a great foundation and built several floors on it, because I feel like part of the challenge right now is a lot, and I'm seeing this increasingly, a lot of CEOs, executive directors, it's like folks are waiting for Superman. Girl, he ain't coming. He ain't coming. Superman is not coming, okay? Or you're waiting for a savior. And I love the Lord too, but we don't know the day or the hour. So until then, I got to do what I got to do, right? And so I feel like this notion that some have either tacitly accepted in their minds as that's the thing that I should count on because that's always been the thing. We need to eject those things from our minds. What are you talking about, Rashawn? I'm talking about thinking that there's going to be some great intervention from a feckless Congress. I'm talking about this notion that we think that the courts, who don't have any mechanism for enforcement of their rulings, first of all, is going to be able to be this impenetrable wall of defense and protection. It is not. And so anybody that is preemptively capitulating, trying to up their respectability politics game, thinking that that's going, your silence will not save you, your respectability will not save you, your ducking and hiding will not save you. You really have to make a choice. And I think that to your question, Gary, the one that I would imagine is happening in nonprofit boardrooms all across the country right now is, are we going to fight or flight? So we can either decide that we need to align in terms of these tensions that you talked about, Gary. The first tension is within you, the leader, and then within the culture of your organizations, and then more broadly in the movements in your areas and that you're connected to nationally. Are you aligned with your values, your integrity, and the funding that you need or are applying for or hoping to keep? Are you aligned in your values and integrity when it comes to the partnerships that you're in or not in? And so I think those are all really important factors. But we've got to align starting within, and then we need to organize. Okay, so we know about Project 25, and I'm glad that Black folks were really trumpeting that well ahead of everybody else before the election, through the election, and since. But now we need a plan for how we take care of our communities. And I mean in the most practical ways. I think it was Daphne who mentioned earlier things like mutual aid and the importance of that. I can't tell you how often I'm messaging Mandisa about some issue I'm dealing with, or vice versa, whatnot. That piece that, we need each other in that way. But I just want to say this one last thing on this particular piece. The opposition is sinister, but they are not smart. And even if they are smart, they sure as shit ain't smarter than us. They are sinister, they are conniving, they are clever. But we are smart, we are resilient, and we are determined. And I think that while we deserve the right to rest, rest is also a tool. That can't be the only tool we show up to this field with. So if we got to cycle out, we gonna rest while y'all go do X, Y, Z, and that's what we need to do. But we cannot sit idly by. And I am here for Black folks being like, well, you effed around and you found out. But we do have to engage, and in different ways, but it's necessary and vital. Otherwise, we're gonna be in a world of hurt. We all have heard it said before or have said it ourselves. White America catches a cold, Black America gets pneumonia. We can't afford to wait for anybody to come in and swoop in and say, oh, the poor Black, they're not. We have to do that for ourselves and each other. So the only tension I feel like has to be negotiated is within. Because once you know who you are, what you do next is not unclear.
Thank you for saying that. Like, I think that, well, two things. One, I think that there are these ways in which I see rest talked about, like in the mainstream, like on social media, where I'm like, this is a form of right-wing propaganda. Like the way like that Audre Lorde is being misquoted, she would stab all y'all. Because like, don't play with her like that. Like, but here's the other part. Read the whole damn text. Read the whole damn text, and you will get the context of which Audre Lorde is talking about self-care. She's not saying, no, I'm not gonna go fight the fucking fascists because I'm gonna do a bubble bath. She's saying, after an 8-hour shift of fighting their asses, I'm gonna go take an hour to rest and soak my feet and and get a massage. And so there's that. So it's this way in which like I've seen like folks take what our ancestors and elders said and left for us as tools for us to live and to thrive, and like twist it in these ways like that, like ultimately serve exactly what Rashawn is saying, like serves their interests, but it isn't serving ours. So thank you for saying that, Rashawn, because it helped me like to think of like something that is so missing in some of the messages. And I think that like is one of the tensions, as well, like because at the same time we do have to stop and we do have to pause, we have to take breaks. But because of, and as a leader, I have to tell myself this all the time, you would be upset if your staff was working to 10 p.m. So Mandisa, why is it 9:45, girl? And you're still at this laptop, still typing away. What would you tell a staff member who was emailing you at 9:45? So you have to apply those things to yourself. So I think like a balance needs to happen because this is a marathon. It's not a sprint. Like this is not a like 2-week situation. And then things are going to be back. It's going to be like a very long time. And even when we're in a different place than we are now, it's never going to be how it was, um, like on November 3rd, 2024 or before, and just like all these things. So, um, I feel like being a New Orleanian, um, and undergoing Katrina helped me to see I'm never going to know, like, I'm never going to experience the New Orleans that was August 28th, 2005. And so much of like the hurt and pain is knowing that, but still fighting for something close to it. And I think that that's like many people have all kind of, you know, human induced disasters like to reference. But I think it's helpful in this moment to think of like what we're fighting for, is actually forward facing and not necessarily backward facing. But I think that also leads like to another tension for CHLP, in terms of this block and build strategy, right? Like how much of our time is spent in a very necessary blocking, posture, right? Of like, how do we, you know, it's not possible to stop all of it, but how can we serve to filter it down? So maybe it was going 80 miles per hour and impacting 100,000 people. Can we block it strategically to slow it down to 20 miles per hour so that's only targeting, say, 10,000? Then that means that then we could focus on supporting those 10,000. Like, how much is necessary to have a blocking strategy? And where's the point of having a build strategy, right? Of acknowledging, um, this is crumbling, this empire is fastly crumbling. How do we build what our people need? And like that's an ongoing tension, and I don't think that we, in full transparency, have an answer. I can't say this is the lovely one pager that CHLP has as the you know um this percentage block, this percentage built, but it's an ongoing conversation like that we're having, as advocates, as people who, you know I'm just going to say this because we're among family. And if you know CHP, you know like why this is a flex, who's now a majority Black ass organization. You know what I mean? Like by far. Um, and so like all of that to say, we are the communities that we talk about. So we know that any kind of win, any kind of battle has a direct impact because we are the people. Like it's not I'm not talking about them, I'm talking about us. And that really does change the advocacy when you know that you are a part of the work, like that the outcome is going to impact you as well. So,
I mean, I hope that we also keep very firmly in front of our minds the fact that many of our organizations are disproportionately impacted by what's going on. I don't think that a lot of the uh, memes that I've seen about rest actually ever talk about the fact that we know that many of the government jobs that have been cut were Black people's livelihoods, and the grants that are being cut are Black service organizations that are being cut. And one of the things that I have observed is a pernicious activity that's happening not at the federal level, but at the state and local level, where an announcement is made at the federal level that a cut is coming, that an elimination is anticipated. Now, none of this is legal, and so there's lawsuits and legal challenges left and right on all of this. But the counties and some of the states are taking that message as an opportunity to eliminate existing grants that they have, citing that they are not going to have availability of funds. And so they're defunding a whole host of organizations that they may have not wanted to fund to begin with.
Mhm.
So when you say, so when you say it's not going to ever look the way it looked, that's what I feel. That's what I see. I see that this is going to also be used as an opportunity to do some readjustment and realignment of resources at multiple levels that actually put us even further down the chain. Because let's don't pretend that there haven't been people who support everything that's going on hiding in the cut, waiting for just the right opportunity to implement this kind of activity that actually undermines our ability to thrive and serve our populations. And so it's not just at the federal level, this is at multiple levels. And so, what I would hope we strongly recommend to our people is to activate at every level. Don't get so caught up in the Congress that you forget what's happening in the county council or the state legislature. Because just because the feds are doing something doesn't mean the states and the counties have to follow suit. And we have to make sure that they know that the people who are adversely being impacted by this are people who vote for them as well. We have to keep it real. We have to be very, very aggressive about that. And I would say that that's part of how we are surviving out in California is not focusing so consistently on what's happening in the Trump administration, but really focusing what's happening at the state legislature and in our boards of supervisors and our county councils, because that's where the rubber hits the road. That's where we have the most impact to ensure that people get what they need. So um, that also can kind of re-energize and revitalize you when you feel beaten down by all this wave of stuff that's coming out of Doge and Trump land. Give that a rest. Focus on what's happening at the state and county levels, things that are closer to you and that you have more relationship with. And I think that that can be a way to keep your energies up and feel purposeful.
Hmm. So we want to have questions from the audience. I have one more question to ask folks. I'm going to jump down to the, this has been a very sobering conversation. So the final question is, what does radical hope look like to you, in this moment, with, erasure and resistance that we've talked about a lot? Where do you see signs of hope, or where are you wanting to create hope?
I mean, right here on this webinar is hope. I think the fact that we are all gathering together in lots of these conversations, and I think we're going to need more of them. But I haven't heard anybody in any of the conversations I've been a part of, or webinars that I've attended, or conferences, or anything, I've not heard anybody say, you know what, this is it, I'm out, deuces. And so I think that alone means there is hope. What I hope that we do, though, is remember, frankly, who the fuck we are as Black people, and the fact that it's not so much that we've seen tough times. Yeah, we have, but our ancestors, our forebears, gave us a hell of a tremendous gift. And it's not just about the resilience or the strength. That is important. But it's that they gave us ingenuity as well, that we can envision the world we want to see. Much to Mandisa's point about what are we fighting for? I'm really challenged by that. What are we inviting in? If the old way wasn't great for us, ain't much point trying to get it back in place. So what is it that we envision for? What is it that we hope for? Who is the we? Us as Black, us as queer, us as Black queer, us as folk living with HIV. Like, what is it that we are fighting for? I have great hope that we can come together to create such a vision and move toward it. And I don't mean that in that pie in the sky, altruistic kind of way. My hope is 100% vested in Black people. And specifically, the people that I get to work with every day that are on this call, whether they're on this webinar, whether they are, speaking or not, that's what right now is giving me hope.
What I would say, to piggyback on that, is that this is one of those uh, questions and answers that I think can sometimes feel in tension with some of the more mainstream white advocates and organizations, because they do um, tend to present a mindset and a frame that everything that was going on needs to be protected because it was doing just exactly what needed to be done. And I think that Black people shouldn't feel compelled to carry that narrative. And indeed, with somebody like Robert Kennedy Jr., who is sees himself as a maverick and a table turner, we should use an opportunity to try to engage him to talk about things in the system that need to be revised in order to improve the health of Black people. Um, it may not work because I'm not under any illusions that he's actually controlling his own destiny. He's being micromanaged by OMB and Doge and other people in the White House who are manipulating him. But um, with this much change in the air, we would be foolish not to try to use this time for us to really look deeply within our own systems and talk about some of the things that we actually have been trying to get accomplished for a while and have not been able to get accomplished under the previous systems, and to lift those up and speak them boldly in this environment of change. And let's see what happens. It can't be much worse than what they already have planned. Now, the reason I say it may not happen is because many of the things that are happening are so deeply predicated in Black erasure that it may not be possible to get past that. But I do not think that we're going to serve ourselves well if we don't, in a united way, think this through so that we can have the conversation as a community about what we wanted to change in the previous system, what wasn't working for us, how we can make some recommendations for things that actually serve us better, and get those on the record and see what our white colleagues actually say about that and how they respond. That will be useful to us internally and externally.
Yeah, I think that I was going to ask you that question actually, because what you're getting at is we do have to navigate and resist and be smart about how we're doing both, and not just. I think some people want to just give up and say we're not going to try to have programming that's funded by anybody. Really need to think about sort of. I always say to people, it's our money. We're paying taxes. And like, why the hell would we say, oh, I'm just going to give it up? No, we need to figure out how to make it work for us, as Ernest is saying. Sorry, Mandisa, were you going to say something?
Yeah, I was just thinking about hope, which um isn't always at the top of my list right now in this moment. And I actually have to challenge myself to center hope. Because I have to remind myself, um, like Harriet Tubman, right? Like she was a general in the US military. Like she led one of the most successful campaigns ever, in the history of the US military history, like freed hundreds of people at once. She was a strategist, she was a freedom fighter. Um, we mostly know those things about her. But before she did all of those things, she had to imagine and dream that freedom was even possible. And as somebody who is often called a dreamer, or somebody who imagines as a way of being condescending towards me, or like um minimizing the ways that I'm an abolitionist, because that's unrealistic and all of that. I also want to reclaim what it means, like, to be a dreamer and to imagine. It is an integral first step to freedom fighting. If I can't imagine that I can be free, then what the fuck am I doing? You have to imagine and dream it's possible, like before you do it. So I just want to like offer like that is where my hope lies, is in the ancestors and and in the elders. Like I always talk about the one text that is integral to my um leadership, that is the Combahee River Statement. Many of those women are still alive. You can ask them what they were thinking when they wrote that Black feminist text that is useful for all of us. And so that gives me hope. Not in the, oh, like our ancestors fought for us. No, no, I struggle with that because I believe that they fought for themselves, and that's okay. I think it's wild to expect enslaved people to have fought for future generations, as if something's fucking wrong with fighting for your own right to be free. Like that, it really gets very magical Negro, like if it's framed like that. And what they have offered is a gift that anchors my hope in terms of um, freedom, the cost of it, the struggle associated with it, and what does that mean in the moment that we're in. Like folks like to tell the story of Harriet Tubman and like how she would have a gun at your back. But we don't really talk about why she did that. You're not going to ruin it for everybody because you want to turn around. There are 25 people on this trip who have risked everything to go forward. And while I recognize that you want to turn around, this gun to your back is going to ensure that you go for it, because if you go, that jeopardizes the other 24 people. I think of what that takes. She drugged babies, not because she wanted to, but because as a strategist, she understood the importance of, she didn't say babies can't come. She didn't build exclusionary spaces, but she did say in this inclusive space, what needs to happen to ensure our collective liberation. That is the hope that I have, like the ways in which, yes, it's going to be hard to think of like how to build an accessible movement. But as opposed to saying, no, y'all can't come, what do we need to do to make it possible for all of us to get free?
There is one question in the chat that I think kind of relates to that. And the question is, how important are the arts for this movement? And I don't know if anybody wants to
I
pick
want
up
to
on.
piggyback off of Mandisa, and I want to answer that. I live here in South Carolina, and Mitchellville, which is the first self-governed town of formerly enslaved people in the United States, sits a few miles from my home, and my husband's the executive director. But Harriet Tubman brought dozens of formerly enslaved folks to Mitchellville. And at that time, when the Union Army created that town, our people were called contraband. They weren't freed folks, they were contraband, property of war. And I think it's so important for us to remember, my hope sits in who we come from. To Mandisa's point, our folks were fighting for themselves. I've heard stories of folks who know their great great grandmother was one of those crying babies that had to be drugged so they could get across the water. And my hope is in who we are. And my radical hope is in that this moment we will build our community in a way that we want all Black folks to be free, that we get away from who's the right ones to be centered and celebrated and safe. And I love the question about art, because what we have seen through all of this, how many of us have gone back to read whether it's Audre Lorde or Langston Hughes or whoever it might be, to be reminded of what we're built for. The art is timeless. Yes, please put them in the chat. The art is timeless, reminding us that we too shall overcome this, that we too will triumph over this. It's also the place where we can teach our history when the public schools are public schooling because of the regime or whatever it might be. It is on us as community to make sure that our folks know who they are and what they're built for. And so I think the arts are necessary and integral to that. I even think of art exhibits that were happening before all of this, whether it was lifting up LGBTQ communities in the Deep South at the Birmingham Civil Rights Institute, and folks were outraged about it. But art is necessary to our movement and to our liberation. And so I think it's really important as we're thinking about reimagining and innovation of our movement, we can't leave art and culture out of the equation when we're talking about building this tent and expanding a real intersectional movement. So it's critically necessary. It is not optional at this time. And the last thing I want to say, my hope is also in Black folks, loving on Black folks and taking care of each other, and for us not to minimize the contribution of anybody that is working to make somebody else's life better. You know, when we look back at the movement, the civil rights movement, people were doing big and small things. And we need to stop making folks feel like their contributions don't matter. So my hope really is sitting in that we continue to just take care of our neighbors, take care of each other, and that'll radically expand all over, because that's absolutely necessary. And that's how we've even gotten to the point where we are as a people. Thanks.
I just wanted to say really quickly in response to the question about arts and to the one about accountability, because I see it there in the chat. I would just say on the arts piece, and Dafina, you nail, meet, hammer, really right on the mark there. I think that arts are advocacy, and they are also self-care. They are also culture. I don't think that Black culture is something that to me, it is the secret to the secret sauce. That is how we restore ourselves and stay grounded in who and what we are, and not only the influence that it has globally, but the influence that it has on and within us individually and collectively as community. And arts in all the ways, I mean, across the board, we need more of that, because it's going to be critical that we preserve our stories and our narratives in ways that they have clearly shown us they don't care to, unless and until it is convenient, and the moment that that expires, is throw it away, right? So we have to be the architects of those arts as advocacy initiatives, but also we have to be the archivists of these movements as well. We have to preserve our stories and our history. And again, if it's visual arts, performing arts, any other kind of arts, we have a role there. The accountability side of it is, I'm going to say, largely absent. I don't know how any of my esteemed colleagues here would feel. I think that there are pockets of it. But I don't think we have enough of those conversations. Like, I think it was Daphne who mentioned, like, your slip is showing, come on in here, let's have a conversation. Or accountable, like Mandisa said, hey, it's 11 o'clock at night, which I was texting and emailing Mandisa 11 o'clock at night last night. But, you know, I think that is an important part of this, but then also the transparency piece. And I would just say this one last piece, because I know you got to get us out of here, Gary, but I do feel like the most important thing that we have to be accountable to is really not, kind of tying to what Mandisa said about what we owe to our our ancestors, so to speak. We have to be accountable to each other in this moment, and to make sure that we're not giving up on us.
Well, thank you all. We have 2 minutes left, so I just want to say thank you to Daphna, Ernest, Rashawn, and Mandisa. This was a really great conversation, to be continued, no doubt. And thank you to Chioma for pulling us all together. And to everybody, thank you for joining us.
Thank you for
And
having us.
Yeah,
yeah.
Yes, thank you for having us. I really
Thank you
appreciate it.
so
great to
much.
see everyone.
And so if you can continue to connect with United We Rise at Every Black Body on Instagram and Facebook. The next couch conversation with Every Black Body will be on June 24th. That will be part 2 of Navigating and Resisting the Dilemma of Black Erasure, a continuation of this conversation, a slightly different conversation. And we hope that you will all join us and share the word. tell everybody else that this is a conversation we should be having, that they should be having. And it's one that we're going to be having for a long time to come. So thanks and have a great rest of your week.
Stay black, y'all.
I think we will.